Skipping out on regular primary care can be a self-imposed death sentence, especially for Black men. That's a powerful statement, but doctors confirm it's true. As a group, Black men have the lowest life expectancy in America. So the question becomes, why do so many Black men avoid primary care even when they don't face barriers to health care like insurance and cost?
I think men in general, when you look at men in general, they're less likely to be forthcoming with their health issues. That becomes more compounded, particularly in African Americans who haven't historically had that relationship with providers.
Our expert is Dr. Kelly McCants. He's the executive director of the Norton Institute for Health Equity, a heart specialist and an HBCU grad.
We tend to trust people that look like us, where we can have a comfortable conversation about things that we may be embarrassed about, or that we may be uncomfortable with, or that we may not know about. And guess what's at the center of that? Your health.
Heart disease, cancer, stroke, diabetes, kidney disease, and hypertension are among the top killers of Black men. These illnesses alone are solely responsible for the loss of generations of Black men.
If we could control and prevent hypertension, all of those other things that you mentioned would go away. But when it comes to cardiovascular disease and kidney disease, if you control the blood pressure, particularly in African Americans and African American men, those things are less likely to cause what we call in-organ damage, to the point where you have a stroke, you end up on dialysis, or you have a heart attack. And so a lot of it's preventable if we catch it early, have those uncomfortable conversations, and make sure people adhere to medicines.
I said something in writing, and a lot of people have gone back and forth saying, oh, you're just being dramatic. I'm going to say it to you and get your reaction.
Sure.
Actively dismissing primary care is a self-imposed death sentence.
That's strong. That's a very strong statement, but I think it's a powerful one. If you don't have a relationship with a provider that you have had throughout your lifetime, those people have a life expectancy that is clearly shorter than those that do.
Well, our work doesn't stop here. We're going to continue this series, and as we move through this effort, we're going to look at some of the resources that are available to help ensure access to primary care right here in this community. In the meantime, if you've not seen a primary care doctor in a while, it's my hope that you'll make an appointment, because you are worth it. One way to find one is by visiting nortonhealthcare.com/location/Norton Primary Care. And I want to flag something that Dr. McCants said. If we can control hypertension alone, that one thing, all of those other ailments either go away or are diminished somehow. Full disclosure, I'm medicated for hypertension. When I started working with my primary care doctor years ago, it was the first thing he flagged and said, we've got to tackle this first, and then everything else, will be manageable.
Right.
And he was right. He saved my life in that one visit to the doctor. So what's it going to take to get people to recognize that this is critical?
Absolutely. And Eric's done a ton on this. You've got a bunch of different resources on your social media pages, your Facebook, your Twitter, all that stuff. So I really encourage anyone who might have questions to go ahead and check out those resources as well. And I'm excited to continue this conversation.
Thank you.